Hello everyone, my name is Dr. David St. Jean, and I would like to welcome you to the Neurometabolic Center of Chicago's Thyroid Video Series. We've had a lot of people asking for more information. The DVD that we've made for the thyroid conditions in our recovery program is coming out soon. So this is for you folks. We're going to be jam-packing in a ton of information, a ton of applicable information, directly applicable to your life in regards to thyroid dysfunction. So if you or a loved one or a friend suffers from thyroid disease or dysfunction, the information we're going to discuss and will continue to discuss in this series of videos will be just extremely helpful to you. So check in. We're going to be doing this 2 times a week. We'll have a whole bunch of thyroid information on the variety of social media that we use, as well as our website. So you can find us in many different places. We're going to review a variety of topics related to thyroid disease, but specifically ones that relate to hypothyroidism and Hashimoto's thyroiditis, which is an autoimmune attack of the thyroid. And all of these topics are aimed to provide you or your loved one or your friend with the information and the resources that you need to make educated health-related decisions, right? That's really what it comes down to, folks, is empowering you with knowledge. You need to have the right knowledge, the truth, to make the right decision, right? And too often I see patients that had no idea that some of the information we're discussing here was applicable to them and could help them. So listen carefully. The truth is, when it comes to thyroid, there are a variety of different options that you can take to recover your health, and all of which most of the time do not require pharmacological intervention. That's a huge statement right there, right? I will say that there are times in severe cases, or maybe the patient has been suffering from the disease for too long, or there's a variety of other variables that are preventing them from getting better, in which a drug intervention is absolutely warranted and absolutely needed. But many times that's not necessarily the case. So where we stand at the Neurometabolic Center of Chicago, our point of view when it comes to pharmacology and thyroid is we're pro-pharma. We believe that it's absolutely necessary in certain conditions and situations. But we also believe that you should take the time to explore the other options, because most of the time you don't need the pharmacological intervention, and it would benefit you greatly to explore other ways in which you can recover your thyroid function, like nutrition and lifestyle, etc., and some of the functional medicine and neurology that we do in our clinic. So today's discussion is the first video of this series. So that's exciting, right? And we're going to center the focus here on one extremely common and very important question when it comes to thyroid dysfunction. I've heard this question over and over and over again, and many of you watching may have already experienced this, and that is this: why are you continuing to experience hypothyroid symptoms? Why are you suffering from symptoms continually when your blood tests are consistently coming back normal? Like, how is that possible? This is an extremely frustrating situation for many of my patients and many of you listening. Like, here you are, you're suffering. You're gaining weight, you're fatigued, you have constipation, diarrhea, you have thinning of your hair, you're intolerant to cold. There's a variety of symptoms that we could just continue to list, right, that have to do with hypothyroidism. But you're suffering from this, and yet your blood tests are saying you're A-okay, you're healthy. That's crazy. That's frustrating. So you and your physician might be observing that this normal marker, right, on the blood test results. But you know that something is still wrong because you do not feel good. And you, folks, and remember this, will always be, especially when you're healthy, your best doctor. Don't let anybody tell you different. You are your best doctor. You know your body the best. You're in your body at all times. You can relate to it. If you're not feeling good, then things cannot be normal. That's impossible. How can anything be considered normal when you're continuing to suffer from these symptoms? Now, there is an explanation for this phenomenon, and it's directly related to laboratory reference ranges. Okay? You must understand that most conventional labs utilize bell curves to determine their reference ranges, right? They calculate an average of all the people they assess and all the different markers over the course of a certain duration, usually 1 year. And this accumulated data determines their normal versus abnormal reference ranges. And at first, this appears logical. Like, this makes sense. Of course they would do that. However, it's all about perspective when you think about it. What kinds of people go to these laboratory facilities? What kinds of people go to labs? Is it healthy people or sick people? Sick people, of course. So for the most part, the demographic frequenting these labs is made up of sick people. And therefore, the ranges for what is considered normal or healthy are way too wide. I mean, think about that for a second. This is usually why you have been told your lab tests are normal, even though you're still suffering from the associated and frustrating hypothyroid symptoms. So if you are still enduring these symptoms and you're being told your blood tests are normal, there's a good chance the proper reference ranges needed to accurately diagnose your condition are not being used. We utilize functional laboratory ranges at our clinic, ones which are much more sensitive and specific to their conventional counterparts, right? They're way more sensitive. And this allows us to properly diagnose and identify whether or not your thyroid gland has become compromised, and if so, how it has become compromised. Now, as you can see from the picture here, if you fall within the green areas, you would have been considered normal, right, by conventional standards, even though you're not. You're either sick or becoming sick or sicker. And really the take-home point here, folks, of this discussion is if you're experiencing hypothyroid symptoms while your blood tests continue to come back normal, it's time to consider working with functional reference ranges so that you can properly diagnose and treat your condition. Otherwise, you're gonna experience the same thing. You're gonna keep on feeling the way you are, and the tests are gonna continue to come back normal. So for more information about how you can find relief through our thyroid recovery program at the Neurometabolic Center of Chicago, you can call us at 312-869-9780 or email info@drstjean.com. You can see that on the screen. And just as a reminder, I just want to touch base on this. If you are unable to travel, let's say due to your location or your job requirements, you may be eligible for our phone consultation program. I work with patients all over the country. You know, some in San Francisco, Florida, all over the place, and I'm in Chicago. I always encourage you to make the trip if possible, but if it's not, certain conditions can in fact be treated using this type of interface, a phone consultation. So for more information, just log on to drstjean.com and click the Clinic Info tab from the navigation bar or the navigation menu on the top and select Phone Consultation Program from the drop-down menu, and you'll get all the details that you need. So thank you, and join us for our next thyroid video discussion later this week with tons more great information. This is Dr. David St. Jean. I'll talk to you soon. Bye-bye.